Hi everyone, it's Professor Widener. Welcome to week number 4. This week we're going to start talking about critically appraising knowledge for decision making. And what that means is that when you look at a research article, you're going to have to decide if it's a good article, if it's a bad article, and different things about it that make it qualify to be part of your study or part of your evidence-based practice change that you're willing to make. This isn't something that you learn overnight, and this week is just basically the introduction to that. There are, I'm going to have my lecture, but there are a few articles that review it as well, and this is just the beginning of the process. And then through module 3, which is week 5 and 6, we're going to review more about appraising the evidence and looking at some of the statistical testing reviews. Again, just to refresh your memory, and then what we'll do is apply that in the discussion board during week 6. But this is, it's called a rapid appraisal, and we're going to learn how to do that, and we're going to go over the parts of deciding if this is a good article or not. And what we're going to use this to see how we can build our evidence. Most of you have questions, or at least a really good topic right now, and this will help you build your articles and evidence to support your topics. So again, this is kind of the next step in the process of building your data to either present your project or actually do your project if you're in the DMP program. So there are two main kinds of knowledge. The first is external evidence, and that is what we know as research, clinical practice guidelines, or articles about evidence-based practice projects, or quality improvement projects that set national benchmarks. And the key about that is that it's generalizable to other practices. So that's what we're hoping to develop, especially if, if for our MSN students, maybe you'll find out something really great in looking at the articles, and you'll have an article about an evidence-based project. Or for our DMP students, you may even perform your project or quality improvement project and have something really great that other people may want to try. If the other source of knowledge is internal evidence, and what that means is that's evidence-based practice through quality improvement or outcomes management. It can also be evidence-based management, but the big difference with that is that it's not generalizable to the rest, to other things. It is only applicable to the organization which generated it. So those are the key differences between those. The thing is that it takes all three of those, the best evidence and clinical expertise, which is things that we have learned through our nursing careers, and as we're doing, your nurse practitioner clinicals, you're going to see the thing about nursing is there's part of this that is you can't necessarily always measure, such as patient assessment and evaluation. Like sometimes it's your gut feeling that tells you something is wrong, and that's your clinical experience talking. So all three of these, and then when you add in patient values and preferences, equal how we make an evidence-based clinical decision. But again, it's important to recognize that all three of those are important qualities. So question number 1, which of the following sources of knowledge would be the primary basis for clinical decision making when determining the turning schedule for an immobilized patient? The practice on the unit, the nurse's knowledge of skin breakdown from experience, the preference of the patient and the patient's family, or evidence-based clinical practice for guideline on preventing skin breakdown. What we're going to see is that it's D, and we're going to follow the evidence-based practice clinical guidelines. Those other three are the components of the guideline altogether. And remember, it takes all three of those qualities to develop an evidence-based practice project. When we're comparing evidence-based practice, research, and quality improvement, we're going to start with evidence, and I think it's important that we kind of make sure that we know the difference between these, because when we were doing our questions, some of you were getting them confused a little bit about what is the evidence-based side and what is the research side. So first we're going to talk about what evidence-based is. That begins with a clinical inquiry, like what you see in a practice or in your practice setting that needs fixing. And then you're going to formulate that into a searchable question, which is what we've done with the PICO format. We're then going to conduct a systemic search for the evidence. So this is what we're going to start to do. Look for the evidence and then critically appraise the evidence. The next step is going to be to integrate that evidence with our clinical expertise and the patient's values and preferences to make a decision. And that's what we're going to do in this course. And then as you move on in your coursework here at Misericordia, you'll evaluate the outcomes and disseminate the findings. But remember, you're getting your evidence from what already exists. You're not making new evidence. When we look at research, research asks a question or defines the purpose of the study. So that is a question in which we think, what is this problem? And now we want to develop a new way to fix it, or a hypothesis as to how it could fix it. So once you have your question, you're going to research and review the data or the literature that's already there. You're going to define a conceptual framework, which means you're going to define how you're going to perform the study and what it's going to focus on. Then you're going to design the research objectives, the hypothesis, the variables, and then you're going to pick the type of study you'd like to conduct, whether it's a qualitative study or a quantitative study, and you're going to decide specifically who the population, the sample, and the setting will include. And you may even hear you'll have inclusion and exclusion criteria, and that's where you'll do that. Then you're actually going to test your hypothesis or actually conduct the study. Once the study is conducted, you'll collect and analyze the data. Now, this will be raw data based on the study that you did. Again, this is going to be something new that has never been tried before or is being executed in a different way. Once you have all that data, you're going to draw your conclusions, and then you're going to disseminate or put out there your study results, implications, and limitations. So this is the big difference, again, between the DNP process and the PhD. In the DNP, you're taking evidence that already exists and applying it. And when you have a PhD or a research focus, you're going towards developing brand new information. I hope that makes sense. And if you have any questions, just please ask. Then when we throw in the comparison of using a quality improvement project, and we're using the Plan, Do, Study, Act model, this is used more on a smaller level. This would be like quality improvement would be used at like a hospital level or as an office level to define what what needs to be improved. So what they do is plan and observe the change. They would do the study and try it out on a small scale. Then they would study it, analyze the data, and determine what was learned, and then they would act on it, redefining what they did, and then based on what was learned, retest it again. So as an example, we had a problem in the hospital where I work as a hospitalist with the emergency room doctors getting the sepsis protocol done within the first hour of the patients being there. So for those of you who don't work in a hospital or have information about the sepsis protocol, severe sepsis has been one of the Medicare's initiatives over the last couple of years, and we needed to improve our scores to get people fluids and antibiotics and blood work faster. So what we did was we had a nurse alert form that they filled out, and the doctors got urgently alerted that there was a possible sepsis person, And then there was also some standing orders that the nurses could use when the doctor said, yes, this is sepsis, initiate the protocol. And what we found was over a couple months that really helped with the system. So then we refined it a little bit more to include some additional things that in the doctor's ordering screen that made it easier for them to order the proper things that they needed. So it actually worked out really well and improved our completion of the sepsis protocol. So that's what we mean by a quality improvement project. You try something on a small scale and then give it a whirl and see if it works or not. So the three of these together, again, they all work together to give us new evidence as to, overall improving our patient care. So what is critical appraisal? Critical appraisal is the process of evaluating its study for its worth. And these, you're going to learn terms about reliability, validity, and how it can be applied to your clinical practice. And what this helps us distinguish is what is the best evidence from what is not good evidence and what is the unbiased evidence from the biased. And then we're also going to learn to look at the level of the evidence with the quality of the study and determine the strength of the study. So let's talk a little bit more about what it means to critically appraise something versus a critique. A critical appraisal is the process of evaluating something for its worth, all the things that we just talked about. A critique is something that is an in-depth analysis and critical evaluation of a study that identifies its strengths and limitations. So critical appraisal is what we use in evidence-based practice, and critique is something we use in research. They're just a little bit different processes, but have the same goal of determining what is the evidence that we have now available to us to support whatever our project is. The strength of the evidence is determined by two different things. There's the level of evidence, which is reviewed from the evidence hierarchy, which I'll show you next, and then the quality as to how well the research was conducted and reported, and we're going to talk a little bit more about those. But this helps us determine the strength of the study. Like if we want to implement a change for our patients or our practice, we want to be sure that we're using data that is quote unquote good or is going to help improve things. So when we look at the strength of evidence in our rating pyramid, we're going to, the top is the best evidence, working downward to the evidence that isn't quite as strong. So at the bottom, we have qualitative studies, expert opinions, theories, and basic science. And that is some lower level research, but again, very important because it provides foundation. The next step would be non-experimental studies. And then as we move up, you're gonna learn about experimental research studies, which are RCTs. And the top level of evidence is a summary. And that's basically where someone has looked at 10 or more articles about something. It could even, however many articles are available that they can find, and they take the strong points and the weak points from all those and combined it into one article to provide a summary of the evidence out there. So as you're going through planning for your projects going forward, we're going to ask you to look for one RCT or experimental research study. You're going to have one systemic review, which gives you an overview of all the evidence that's out there. And then we're going to also ask you to look for a clinical guideline to support what you do. And I think I've directed most of you to a clinical guideline in your PICO questions on the discussion board number 2. But if you have any questions, again, just ask. If you cannot find a guideline or a summary, we can substitute in another RCT. But so as we're going through different articles, that's going to be our goal as to what you kind of send you out of this class with, to get those 3 strong articles to support your topic. So when we're grading the strength of evidence, there's 3 domains, and the first one is quality, and what that means, it's the extent to which the study's design, conduct, and analysis have minimized selection, measurement, and confounding biases. That is our internal validity. And the quality means that the number of studies that have evaluated the clinical issue, the sample size, the magnitude of the treatment effect, the strength of the causality assessment for interventions, such as the risk, the relative risk or the odd ratios. And some of this is going to sound a little bit foreign, but again, we're going to go through these a little bit more in depth over the next couple weeks. Next week, we're specifically going to talk about appraising the evidence and doing the statistical reviews, and then we're going to take all that and review the different kinds of research. So again, this week is just basically an introduction. And consistency means that whether the investigations were done similar or different studies, the reports have similar findings. So that also requires numerous studies to be used. So which of the following is the following statement true or false? Determining the validity, reliability, and applicability to practice are central to a critical appraisal of the study. And that is true. Critical appraisal is about determining the quality of the study, which includes the validity, reliability, and applicability to practice. And that's, again, what we're going to keep talking about. This is just to kind of get you start thinking about these this week. And that's what those articles will do as well. And if you're looking for places, these would also be good places to find benchmark or guidelines. You can check out these different databases from the government. They will be helping. And you can also check out Healthy People 2000. So again, as you're focusing on your projects, we want to be contributing to the population as a whole. And if we link that back into Healthy People 2030 now, it will again help support your project. So if you have any questions, please get in touch. Take care.